Hello, my name is Emily Morejon, and I'm a fourth-year medical student pursuing a career in family medicine. I'm especially passionate about childhood health education, women's health, and preventative community-focused care. I chose family medicine because I want to build long-term relationships with patients and communities and help empower people through education, partnership, and culturally competent care. As I think about the kind of physician I want to become, osteopathic principles will be central to how I approach my patients and my practice, far beyond the use of OMM. For me, the osteopathic philosophy is a framework that helps me see the whole person, not just their symptoms. The idea that the body is a unit, mind, body, and spirit, guides how I assess and interact with patients. In family medicine, this is essential. A child struggling with recurrent abdominal pain may also be navigating stressors at school or at home. A woman with chronic fatigue may be balancing work, caregiving, and limited access to resources. Approaching patients with that full context in mind helps me deliver care that is compassionate, comprehensive, and respectful of each patient's lived experience. Osteopathic principles also emphasize the relationship between structure and function, which supports my interests in preventative health. I want to help patients identify early signs of dysfunction, whether physical, emotional, or social, and collaborate on ways to restore balance before disease progresses. This might mean teaching families about ergonomics and posture in children with heavy backpacks, or supporting postpartum patients in strategies to improve sleep, nutrition, and stress management. Osteopathic medicine pushes me to think proactively and holistically rather than reactively. One of the most meaningful principles to me is recognizing the body's inherent ability to heal. In practice, this means positioning myself not as the fixer, but as a partner, someone who supports patients in accessing the resources, knowledge, and interventions that allow their bodies and lives to move towards health. Whether I'm providing anticipatory guidance to a parent or helping a patient navigate behavioral changes, I want to honor their strengths and individuality. Overall, osteopathic medicine shapes the physician I'm becoming by reminding me to slow down, listen fully, respect each patient's story, and understand health as a dynamic interaction of physical, mental, and social factors. As I move toward residency in family medicine, I will continue using these values to deliver care that is empathetic, evidence-based, community-centered, and deeply human. Thank you.